JBC analysis. Now, Mr. Speaker, during July and August, we didn't have the means to accurately assess risks within countries and within regions. The kind of comprehensive Office for National Statistics data that we now have through their testing was never available overseas, and it was too easy for the virus to migrate between regions without borders or boundaries. However, as JBC resources have strengthened, we've been able to collaborate much more closely with other governments and their health authorities. This has led to a more forensic picture. Now, for the first time, we're able to consider a granular approach to assessing detailed data abroad. And I've looked at whether this means we can implement regionalised systems for international travel corridors. But in many cases, the international data is still simply too patchy. And in all cases, there is next to nothing to prevent people from moving around within a country's border. I know that people will rightly point out that infection rates also vary across the United Kingdom, and indeed they do. But the difference is that the countries we're talking about all, by definition, have higher rates of infection than we do ourselves. So I hope the House understands that the JBC and this government are therefore at present unable to introduce regional travel corridors from within the geographical boundaries of a nation state. However, when a region has natural boundaries, like an island, for example, the risk diminishes significantly. And that presents us with a real opportunity. Our passenger locator form, combined with NHS Test and Trace, will give us a clear picture, and has started to give us a clear picture, of exactly where infections are coming from. And as a result, I can today announce a new islands policy. For the first time, we have the data and the capacity to add and remove specific islands from quarantine, while still providing maximum protection to the UK public. There are thousands of islands across the globe, far too many for JBC to monitor on a detailed level. But it may assist the House if I outline the 4 guiding principles which we intend to apply. First, this regionalised approach can only apply to land that has clear boundaries or border, in other words, an island. Second, the data collected must be robust, reliable, and internationally comparable. Third, the island must have direct flights from the UK, or at the very minimum, transport must be able to take place through quarantine-exempt territories. And fourth, the FCDO travel advice should align as far as practicable. The JBC methodology that I've just described for islands has been developed in consultation with the Chief Medical Officer and Public Health England. This new capability means that we'll now be able to nuance our decisions, first and foremost, to safeguard the health of British citizens, but also to enable British tourists to enjoy trips to islands, even if the mainland is deemed too risky. However, it is worth noting that the policy will not necessarily open up additional islands immediately. For example, when we remove Spain from the travel corridor list, there were 24 cases per 100,000. Today, there are 127 cases, and it remains too high in the Balearic and Canary Islands as well. On the other hand, Greece remains within our travel corridor programme, but our new analysis shows that some of the islands are well outside of the parameters. Indeed, despite overall Greek infection levels being lower than ours, Scotland has already felt compelled to add the entirety of Greece, including the mainland, to the quarantine. However, using our newly acquired JBC data, we're now in a position to remove Greek islands where holidaymakers are at risk of spreading the new infection back home, and 7 Greek islands will therefore be removed from travel list at 4 a.m. on Wednesday, the 9th of September, whilst maintaining mainland Greece. Mr. Speaker, I want to thank our medical experts who have forged these professional relationships and improved capacity. However, I want to make one thing clear. Travelling during coronavirus is not without risk. So please, if you're travelling, go with your eyes open. And remember, breaching quarantine is not only an offence which can gain you a criminal record, but you are also putting the lives of your loved ones at risk and loved ones of those you've never met before at risk too.